or worry about an emergency that happened. They are here 24 hours a day, 7 days a week, and good experience in that. They're really giving us very good help in that. So now it's starting to, we're starting to have more and more people, Mr. Tawil. I see. For introducing also the company, and I know we are going to hear it several times today. So for Khaled Masri trying to join Samar and Ahmed, let's just general chat until somebody also join, please.
Wonderful. So thank you again for that warm introduction, Dr. Hazem. It's been a great pleasure serving you and the Egyptian Cultural Office. We have great experience in the student-sponsored space. We do about these students, the Bahraini students, the Turkey students, the So we had to be the largest in the embassy and government-sponsored student arena. So we are familiar and guide each student to the plan. So the difference is to better explain the plan in very, very simple ways. How to find a doctor, for example, in the network. For example, ask for a generic drug and not a brand name drug, for example. Use a nurse line instead of the emergency room, for example. So these types of tips, more in detail, to talk about how can use the plan.
So say hello to Khaled Al-Masri. Are you online?
Yes, I'm here.
اهلا يا خالد، ازيك؟ معاك دكتور حازم. لو في حته كده فيها صوت اقل لان في صدى صوت عندك.
طيب
حاضر. براحتك. مستر طويل هيبتدي كمان متهيألي دقيقتين 3. مش عارف سمر راحت فين بس موجوده. مش على لسه ما اعرفش مختفيه ولا انا عندي قليله. اوكي لا افتكرتك مختفيه بس واضح ان الليسته اللي عندي الليسته is growing يا مستر طويل as I told you as I expected. طيب.
Yes.
Can I suggest that we may, because the presentation is not so long, let's start the activity and try to get some feedback, because the last 10 minutes you may need to go further again with us in the slide. So we
no problem.
Like as you are saying it in details one time and in summary second time. يا جماعة كله اوكي خالد المصري معايا.
Hazem.
Yeah, we can start, but خالد لو سمحت حاجة ما يعني عشان في صدى صوت من عندك يا خالد يبقى اشوفه مستر طويل بيكلمنا بالانجليزي كل
I am in a closed room right now.
يا تمام علشان احنا هنبقى كتير في اي دوشة مش هنسمع. مستر طويل يكلمنا بالانجليزي لانه الانجليزي بتاعه احسن كتير طبعا من العربي، فاحنا هنبقى مركزين. هيكلمنا بالراحه واحده وهيقول لنا على ايه الحاجات النصائح لحسن استخدام النظام التامين بتاعنا، وننزل لاي انكوايري، وممكن نلاقي الموضوع واضح او محتاج وضوح تاني ممكن الاسبوع الجاي نعمل واحده تاني بعد ما انتوا تدوا فيدباك حتى للزملاء بتوعكم. مستر Tawil the word and please start your presentation.
Wonderful. Everyone could please first have their phones on the mute. So, first and foremost, we were able to provide this very rich plan with United Healthcare. United Healthcare is the largest health industry in the United States, with a network of doctors and hospitals. So we have a very rich plan with a company. Okay. Your plan is in effect first. Now, we did a late implementation, so everybody received their ID cards kind of late. What I say first is that if anybody had any medical treatment in those days without having the ID card, get it with office. Okay?
Mm-hmm.
On the screen, you'll see the brochure of a conference call. Do you see the screen, everybody?
Yeah.
حد مش شباب؟ اوكي باين ها؟ اوكي.
Yeah.
On page 2, it has a very brief outline of the benefit summary. Let's go over that briefly. The benefit for the plan, in the past, you had a maximum benefit. And there is no maximum. It's unlimited coverage. Okay? The second line you see there, deductible. Deductible. Preferred providers. The third line, out of network. This is very important. Any insurance plan, in any plan, this company has a network of doctors and hospitals. It is up to each student to make sure that they go to a preferred provider. If they go out of network, the student will have to pay the first $10,000. So
يعني دي مستر طويل بعد اذنك النقطة كل اللي بيسمعونا عبير سالم معانا لكل احمد وخالد وسمد لكل اللي بيسمعونا يونايتد كير الشركة اللي احنا مأمنين معاها عندهم فروع كتيرة جدا ودكاترة كتيرة جدا بيشتغلوا معاهم كتيرة جدا لدرجة مع اي استفسار او اي اتصال هيدلونا على اي تخصص اللي لو لا قدر الله حد استسهل وراح لحد بره النتورك دي هيقول كل حاجه بس هيطلب منه يدفع فهيلاقي لحد لا قدر الله لو حد جاب عمليه ولا حد $10,000 يبتدي التامين وبعدين التامين يبتدي يخش بعد كده فدي نقطه مهمه النتورك اوف نتورك دي اهم نقطه يمكن النهارده عايزين نقولها
دكتور حازم
ايوه
لو سمحت بس يا دكتور في صوت احنا مش سامعين حاجه ممكن بس المنبر كلنا والاستاذ مستر طويل بيتكلم نعمل ميوت للصوت بتاعنا بس عشان نفهم بس
كمبيوتر مش كده
واللي عايز سؤال يفتح السبيكر بتاعه
انا بتكلم من التليفون حازم انا بتكلم من التليفون مش من اوبشن كده اللي دخلت النمره بتاعتي وعملت كول فبتكلم من التليفون بس برضه عملت ميوت للكمبيوتر بس I think انه مش هيعمل فرق يعني.
اوكي برضه بتكلم من التليفون. Okay, I think we have an application on the phone. Why do you use the providers? Okay.
Here we're going to show you the exact ways of how to find doctors in the network. So what we do is let's go to the brochure and we can have questions. Okay? Wonderful. So here the next slide you see the co-insurance. So basically, if you're in the network, that means most medical expenses are cut at 100%. So the doctor network, you show your ID card for medical expenses, not all, but most. You will, okay? But if you're of network C, you pay a lot more money. So again, the point is you always want to stay in that network, okay? Let's go down the line. The physician visit copay, doctor, a copay of $20. Like network. For surgery, of $50. For the room, also a copay of $50. For the medicine, very important. The medicine, you have 3 tiers. All medicine has 3 tiers. Tier 1, Tier 2, and Tier 3. Okay? Doctors always prescribe Tier 2 and Tier 3. It's up to the student when they to ask for the generic drug, which was $1 copay. So, when it gives you a brand name drug, you and say, you know what, I want a generic drug, and you pay a copay of only $0. If the drug, you pay of either 30 or okay.
Okay.
A very broad view of your benefits. The deep benefits came out in your healthcare guide, but this is a very simple way of trying to explain it, okay? We talked about go online, which we're all students. I think we all go online. We know how to go online. It's very resourceful. If any, most important thing when you go online is search for a provider, for a doctor, for a hospital, for urgent care. You can online or on your smartphone. Everything else here is, it's not complicated, but you can definitely use these other resources. Again, important feature online is always being able to find a doctor. How you can go on your account, you can print your ID card online, you do claims letters online, you can look up your online and so forth. It talks about the benefits of going online. Then love personally. We also have United Healthcare. They are our insurance company, and iPhone. So the iPhone app for healthcare. But Health for Me app on Google, and the app on your phone, world could the three things. You basically hit the nurse button. A nurse will call you. On you say, "Hit, have me." It's only a click. You can find a urgent care. Why it's important? An urgent is an emergency room. Our diplomatic and international friends, when they come to the United States, they need to go to the emergency room. Place you want to go. For emergencies in the emergency room, or for heart attack, only for gunshot victims. These conditions. Everything on Saturday, for example, you may have a child that has 102-degree temperature, for example. Have a small cut on a Sunday, for example, and you can't see a doctor. All minor things, you will go to the emergency room. In the urgent care, if you go wherever at in the world, it points you to the nearest urgent care center. A wonderful feature. Okay? There are a couple ways to find a preferred provider. Or you can go online, location, okay, how to find a doctor. Here, side of the screen, there's a guy with his name is Elmo Casper. This is what the smartphone app would look like here. You see that? It says, find my claims, find provider. So, if you don't have an ID card, you can click and show any doctor on your smartphone app. You can find urgent care. You can find doctors. You can find labs, work trays. Okay. Next page. Here it gets very important. This is where it gets very simple also. This plan. Okay. The first point is the importance of the nurse line. Okay. Earlier, it could be a Saturday, for example, and your child is not doing well. That we have as parents sometimes go to the emergency room right away, but it be very minor. So we have a nurse hotline 24 hours a day, 7 days a week. If you can mute the phones, please. Background. If you can mute phones, I think, Mr. Khair.
Yes. Sorry for this.
If we can mute our phones, please.
Okay, sorry for this.
Okay. Okay. Yeah. So, the first point you mentioned is that the nurse hotline. Okay. So, I'm sorry, if you guys could please mute phone, please. MFE. Please, MFE, you there? Hey, can you please mute your line, please? Thank you. Okay. So here on the plan, we have nurse hotline. So instead of emergency room, it could be simple. If you have a child on a Saturday, for example, call the nurse hotline. On the you have the Collegiate Assistance Program. The way to say to the nurse, my child has a high fever, he has this, whatever, but would tell you exactly how to go. The nurse may say, go to the nearest pharmacy and pick up, for example. They say it's very urgent, go to the urgent care. They say emergency, go to the ER. But the point, the nurse that you have available to you 24 hours a day gives you, it's very important to have. So keep that close to you. It's a committed assist phone number on your ID card. Okay? Now, the reason men not going to the emergency room is because group, the insurance group do not know how to use the plan well, then next very high increase. If you here, then not allow us the same rich benefits we have this year. Point all have a role. Better understand when to the urgent care, when to go to the nurse, to use generic drugs. Because the lower cost that we have, the lower cost of renewal is, and the idea is we want to keep this plan for a long period of time, so we all roll in that. Okay? The only emergency room, see this, like chest pain, fainting, trouble breathing, broken bone. That's really an emergency room. That's it. A lot of they They have insurance. Well, sometimes it's as simple as making sure that every doctor, every hospital, every time you see them, all present your ID card. You have to by yourself, or to show them the ID card on your smartphone app. But making sure every lab work, every hospital has a copy of it, so the clinic can process automatically. That way. Important, the drug products. Now, the importance of a pharmacy on doctors. Doctors do not understand how to write drug prescriptions. They do not do. They name prescriptions that the doctors are advised to write by the drug companies. Okay? It is us, the students, to go to the say, no, I have a drug. I never drug. So drug, you pay of $0. If you want a name drug, it's for $40. The important times that we choose generic, the more we choose generic drugs, the plan, and the longer to have a rich plan like this for the students of Egypt. The way we use insurance. So the generic drugs at the pharmacy. Okay? Next slide. This is how you benefit. On vacation somewhere maybe, and something. Here we have experienced crisis management professionals. Again, this is all on your ID card. Third world country where here we have air and ground ambulance service providers to help you worldwide assistance. F is as whatever challenge you can call, definitely help you through the crisis. But if at ever you have somebody to assist. Okay? Is what I think is the most important slide here. It's basic contact information. Okay? So information and questions. And by so doctors in the network. I'm in the smartphone app. I hit 5. If you make a phone call, that's fine. Call this number and simply say, my name is John Doe. I live here. Please me a cardiologist or a general doctor network, and they will help you through that process. Or, for example, if something occurred, you will call this number. Very general questions, you will call this number. Okay? Or email them at this email here. For our 7 nurse line, again, card, you have a collegiate assistant program number. This phone number, the same that you see at the emergency room, is your phone call. You want to find for everything. It could be a cut, it could be a fever, it could be a what call guidance. It's very important. Okay? For the services from Frontier Medics, you will call there. If you love the United States, you will call collect at this number 404-53630. Again, this number here is for global emergencies. God forbid there's political chaos somewhere. If Egypt, if you have back home in Egypt, you have where you can call to get assistance. Okay. And last, in the event of complicated claim issue, a lot of things happen. The plan is perfect, but every problem to our agency has a solution. Okay? So you can do two things. Give a issue. You will come to my office, and I have a team in my office that knows the account and stand by, as you are very important to all of us. You would call 03-880-100 or email us at ECEB@warrior.com. All is your on the card, a copy of the invoice from the doctor. What invoice? Oh, it's not covered. Whatever they explain briefly, what they he will respond simply with an answer. That's the end of the presentation. So for questions, Dr. Hassan, what do you think?
اوكي ثانك يو وشكرا لكل الزملاء اللي موجودين. The type of formative sessions are very important. لو الزملاء كلهم سامعيني طبعا بحييهم مرة تاني. 7 أو 8 من المبعوثين، لكن احنا يمكن العدد مش كبير قوي، احنا وصلنا 100 وشوية زائد العائلات، ف 7-8% دي عينة كويسة تقدر تبروفيد ذا نيوز ونعمل أكتر من مرة سيشنز على كده. الرسالة اللي نحب في أكتر من نقط هنا نحب نقولها. أول حاجة طبعا نتمنى الصحة ومهمته على خير ويرجع إن شاء الله بسلامة لمصر بإذن الله. الثانية إنه في بعض الزملاء لأن ما كانش عندهم معرفة قوي بالسيستم ويعني ايه اوت اوف نتورك ويعني ايه جوه النتورك، ويعني يتوصف لي دواء الدكتور بيكتب دواء باسم، لكن في دواء اللي هو التركيب اللي كلنا كنا بناخده كطلبة ما بتدفعش عليه أي حاجة. يعني ايه مش كل مرة اروح الطوارئ، لا ده في حاجة تانية اسمها الارجنت كير قبل ما اروح الامرجنسي روم. كل دي حاجات كانت ادت الى رفع الخدمات، وبالتالي فوجئنا السنة اللي فاتت قبل ما نيجي انه مساحة التأمين عالية، وبالتالي بالظبط يمكن 3-4 شهور لحد ما رجعنا حاولنا نرجع الامور تاني الى نصابها، وان تبقى سمعه برضه الطلبه المصريين كويسه في الاستخدام الامثل للتامين، مش في سوء الاستخدام من البعض. يعني انا ما بقولش الكل بيعمل كده. فيبقى احنا لما نعرف، لان كلنا محتاجين نعرف ازاي اقدر استخدم نفس حقوقي، بس لا انا ادفع ولا دفع شركه التامين ولا دفع المكتب، لان خلاص احنا لينا باكج معينه استفيدها. ازاي في الطوارئ اكلم سواء النيرس او اكلم اروح الارجنت كير، ازاي لو كانت قبلي بريسكريبشن وانا رايح الصيدليه اقول لهم ان انا عايز الدواء التركيب بتاعه هو نفس الفعاليه ونفس كل حاجه، ازاي ان انا اقدر اقرب دكتور مني سواء بنكلم 1-800 نمبر ببلاش او انزل ابلكيشن على تليفوني. حاجات كويسه جدا. احنا خدنا 40 دقيقه وفضلنا 20 دقيقه. انا حبيت الاول اشكر مستر طويل واسمع من الزملاء اي استفسارات واي اسئله، لان اللي انتوا هتقولوه هيمثل بعض الشيء استفسارات لكل الزملاء نحطها في اصل كويشن، نعمل السيشن تاني او نعمل لينك للسيشن دي لانها ممكن تكون متسجله والناس تسمعها. فيعني شكرا مستر طويل، ادي فرصه للزملاء هم اللي بيستخدموا ما يسالوا وانا هبقى اسمع وارجع اشكركم تاني في الاخر. فعنده اي سؤال لمستر طويل مش واضح اتمنى يساله له. اتفضل يا فندم.
Okay. May I ask about the dental problems? It's not covered. I think it's not covered yet.
Yeah, that is not covered. Dental that will be covered is, God forbid, some of your accidents, for example, maybe our teeth is smashed, but covered at all. Actually, knees, no things, none of it. Only for an emergency if your accident, God forbid.
نعرف كله ان مع البعثات بيبقى النظر مش مشمول، السنان مش مشموله، طبعا الحمل والولاده مش مشمولين، دول معروفين طبعا من قبل ما نيجي كلنا يعني، وده طبيعي.
نيو بلان بقى يا دكتور حازم، فقلنا نسال برضه.
تسال كويس عشان من بعيد
سال، فقلت اسال.
كويس. انا نفسي ان الزملاء يبقوا دور برضو، يعني انه يوصلوا المعلومه للزملاء الاخرين كمان اللي ما جاتش فرصه يحضروا معانا. مستر طويل وشركه سحوري اولا عندهم استعداد في اي وقت يعملوا لنا اي سيشن تاني زي ده. تليفوناتهم شغاله 24 ساعه 7 ايام، يعني يتاخروا علينا في اي حاجه. فاي زملاء برضو لو عنده اي سؤال كبير صغير يتفضل. اهلا
دكتور حازم. دلوقتي انا بس معلش عايز اسال سؤال. دلوقتي بالنسبه لو انا رحت عياده كلينيك في النيتورك بتاعنا هضطر ادفع مبلغ $20. طب لو هل في اي فحوصات تانية انا حابب اعملها، تحاليل، اشعه، الكلام ده، هل برضه ده كفرد ولا نوت كفرد برضه؟
Understand this in Arabic or he needs to ask in English?
I caught a little bit of it now, but if you could, that would be perfect, please.
يعني Ahmed, you were saying, Ahmed, okay, payment of $20, okay, for any visit to doctors. This is some sort of
investigation,
analysis, lab analysis, whatever, something like that. How about exactly?
That's covered. Usually, a lot of doctors, they have the basic blood work, basic X-ray. It's all in the name of. That's all.
Okay.
But for complex X-rays, MRI, for example, or CT scan, for example, or PET scan, for example, these are done usually outside of the office. That's separate. That's a copay of $100, the complex imaging. But the basic X-ray and the basic blood work is usually done inside the doctor's office, and is pay of $20.
Okay. Also, what about children vaccination?
All covered. So every school vaccination is required for you.
Not for me, for my children.
It'll be covered too. Any required vaccination will be covered.
Are we sure? This Mr. Tawil?
Yes, not travel ones. For example, you want to have a malaria, for example. It's for malaria. That's very common.
Because this is the good news also for this vaccination issue.
Not like this before.
It's covered. It's covered. Only the state required ones are covered. Not all.
For example, this is a very important question, really. Okay, if some of our students they have their sons in the school, so there is some sort of needed vaccination. I think you need to check with this. شباب احمد وجمال دول التامين اللي فات ما كانش مغطي الفاكسينيشن مش كده؟ اوكي.
طعام اولادي من ولا حاجه.
ممتاز. Okay, so the previous was already covered. So okay, we go with Mr. Saho, Mr. Tawil. Now cover the basic one. Please.
الفاكسينيشن ده يا دكتور حازم بيكون عند نفس الكلينيك دكتور، ولا بيكون مثلا في سبيشال سنترز بره؟
No,
لما تسأل يا أبو حميد بالإنجليزي directly.
Okay, I'm sorry, look, Mr. Tawil. Okay, I'm sorry, Mr. Tawil, about the vaccination services, it is in the state center or with the clinic?
Like, it's the or any doctor have the basic shots in their flu shots, the simple vaccinations, it will all be done in their office. The vaccinations for like malaria, for example, may be done outside. So what I recommend is call the number here on the screen, 800-767-0700. If it's a specific one that you are unsure about, call them and see if it's going to be covered. But basic state-required vaccinations are all covered and usually done by the doctor.
Think.
You're ready?
Hello. Hello.
Yes.
Good afternoon, Mr. Tawil. All of thanks to Dr. Hazem and for you also. My question is, I went yesterday to a doctor who is in the network, asked me for any fees, and told me that they will contact the health insurance company regarding the fees. They prescribed me a medicine which I take from one of the pharmacies without any fees or anything. So, what is the problem now? I think you will contact me regarding these fees or billing me or something like that.
That's how it should work. What you did was the right thing.
No problem.
I mean, anytime you pay nothing. No, but what you did, you need to work, okay? And you show your ID card. Everything is done now behind the scenes. That's why it's important to go in network, because you show the ID card. At that point, they then do everything. They file the claim for you. They have direct payment from healthcare for you. You see? And the medication, was generic drug. You see? So the reason why it is put zero there, we will persuade all the students to use generic drugs and pay nothing. If they want name drugs, they're going to pay a lot more. That's why it's important to always ask for generic drugs at the pharmacy.
معنا برضو انه حد يعني لا قدر الله اضطر يروح لدكتور وعنده دواء معين، الدكتور هيكتب زي ما بنكتب في مصر اسم الدواء اللي هو الاسم التجاري، الاسم التجاري. هناخد الروشتة ونجيب بيها الاسم التجاري هيدفعونا من 30 ل $40 لان ده طلبنا. لكن نفس المادة الفعالة ونفس كل حاجة اللي بيحطوها لنا في العلبة البلاستيك دي بالعدد الكوبايات المطلوبة، دي المادة الفعالة والدواء العادي اللي موجود في التأمين الصحي بتاعنا في مصر. ده وبالتالي ما يدفعكش أي فلوس خالص، ده علشان حضرتك خدت الدواء المفروض يعني ما تكونش خدت فيه أي فلوس. اتفضلي
يا دكتور معلش، يعني لما نروح عند الدكتور بدل ما تكتب لنا اسم الدواء اللي موجود على العلبة اقول لها بليز اكتبي الافكتيف انجريدينت او جينيريك فهمت.
اظن مستر تويل يصحح لي، الدكتور بيكتب الدواء حتى لو باسمه التجاري، لكن وحضرتك في الصيدلية بتقول جينيريك. مستر تويل we are asking now with the doctor and write me a certain medicine. Okay?
Yeah.
Commonly he writes the commercial name. And go to whatever CVS or whatever, we ask for the non-commercial name, which is the one. So they ask the doctor while asking the prescription for a generic name or a generic directly. I don't think it works like that. He writes whatever medicine and ask for the generic. So it works like that.
Some do not know what generic drugs are. The generic name of a drug is usually it's it's a scientific term. It's a complicated term. So I know how to write generic drugs. It's the responsibility of the student to always ask for generic.
يبقى محدش هيحفظ سيليك وفر اسيد قد الدهيه كده، لكن هو خبط حراره معينه بالتالي احنا على طول الطبيعي ان ناخد الجينيريك ما ناخدش الا المكتوبه.
And also doctors benefit when they prescribe brand name drugs. In mind.
زي دكاتره في مصر ممكن بيبقوا مع شركات معينه لادويه معينه انه بيديها كتير. مش طرف في الموضوع ده، هو كاتب ان العلاج بالدواء الفلانيه او الدواء الاسم الفلاني، احنا بناخد الدواء التركيب اللي مش اي فايده لاي شركه معينه بتنتجه، يعني بينتج انتاج ماس برودكشن من خلال الشركات الحكوميه.
A question regarding this point. Dr. Tawil, are you dealing with certain pharmacies, or we go to any pharmacy and how we should perform?
Again, United Healthcare is the largest health insurance company in the United States. All the big pharmacies, Walgreens, Rite Aid, ECEB, Giant, Walmart, every one of them are in the network. So that's a small pharmacy, you know. Don't go to a small corner pharmacy like Joe's Pharmacy. Go to Walgreens, Rite Aid, CVS, the big names. You should.
خليني اقول since we have like 5 minutes left، دي مهمه جدا رغم بساطتها، ونتمنى ان انتوا تقدروا تنقلوا لزملائكم برضو نفس الفكر والاستعداد مع طويل وشركه سحوري البروكر بتاعنا او الكوردينيتور بتاعنا مع يونايتد هيلث كير، وهي يعني من اكبر الشركات في التامين. هنبقى سعداء ان دايما نحرص على الاستخدام الصحيح، ربنا يديم علينا الصحه، لكن يبقى في استخدام صحيح ناس فوائد اكتر لما نيجي نجدد السنه الجايه. اما استخدمنا او الزملاء مش انتوا، يعني لو حد بيستخدم استخدام جائر يعني على الفاضيه والمليان، واظن ان مفيش يعني قليلين خالص، الشركات تتحفظ وتبقى قلقانه مننا وتدي عاليه، فنرجع في مصر يقول لك لا طب ما تشوفوا لنا حاجه ارخص لان مش البادجت، فنبتدي ناخد خدمات اقل. فبقينا احنا ولقنا اللي انتوا هتوصلوا لهم هذه المعلومات ان احنا نحسن استخدام السيستم ونحافظ عليه، وكل ما حافظنا عليه كل ما ممكن يجي لنا كل سنه بنفيتس اكتر. فهو احنا في فتره اختبار دي، وان شاء الله هنحسن الاستخدام وربنا يديم الصحه على الكل يعني ان شاء الله. مستر Now, if somebody else has a question, okay, there is only 5 minutes left. I will let you also for more guidance and expectation in the future. How can we make this information propagate with the others? We can do other. We can make links for things like that. Please go ahead.
So, number one, this recording has been recorded, so I can put recording so people can hear it again if you like. Also, we'll be honored to do it again. We can do this during the weekdays, for example, maybe at like 5 o'clock Eastern time. We can have these conferences to get everybody used to how to use it. Whatever you like, Dr. Hazem, we're here to assist.
I will check. First, you have a record of the people who joined, so we know are these all Eastern side or Western side, and we need to time we need new people joining, and you can give us the link for that. We can even give it to our students everywhere. It's no problem. Okay, the link itself, everybody can benefit, and we can, if they have additional inquiry, we can still make another one, but maybe a few weeks later. These we are trying to make it as early as possible in order to guide the use in the best way since it starts. That's a very good potential. When we get the link, we are going to send the email with this link to all the students who are under our group. Okay?
perfect.
Okay, Dr. Hazem.
Yes, اتفضلي.
سؤال بس لحضرتك. Thank you Dr. Tawil, but I have to Dr. Hazem. Dr. Hazem, أنا دلوقتي since يعني received الإيميل ده، فالمفروض إن أنا already في البلان دلوقتي، بس ما استلمتش أي ID أو أي confirmation mail من United Health إن أنا member دلوقتي. أنا مش
مستر طويل برضه.
Okay, so
Yeah.
Tawil, since I received this email now, like 2 days ago, so I assumed that I'm already in United Healthcare, but I couldn't log in United Health, and I have no ID number. I don't have information. So how can I download my ID? How can I link to the website?
So what happens, a lot of students did not receive their ID card. What they did is they emailed the ECEB@.com. To the last page, and just say my name is, explain my date of birth, please ID card. And then my office contacts you immediately with a copy of your ID card and the instructions to log online.
But the question again. So since I received the email from you, I joined United Healthcare already. That's right.
Absolutely.
Okay. Here. Thank you very much.
But the ID cards, they're not printed out. The idea is that you log onto your smartphone app to hard copy ID cards.
How can I?
Finally, here, wonderful word. Each one coming to the United States has to be fully covered from day one of his arrival, if he is the member of the mission. And of course, after 3 months, he's a family member. So of you, we ask Sahouri and United Healthcare that you are from day of coming. No one is allowed to stay without with insurance. But the official work takes few days in order to issue the card, which comes with the date, the coverage, the date of your arrival. Okay?
سمر حضرتك عايزة تاخدي على الأقل نسخة من الاي دي بتاعك. كل اللي هتعمليه حضرتك هتروحي على الموقع بتاع اليونايتد هيلث كير اللي هو UHC، هتلاقي في لوج ان وفي كرييت ماي اكونت.
اوكي.
ايوه.
كرييت لو انت عندك اكونت مسبق اوكي ادخلي بالباس.
عندي اكونت. هو انا اخر انشورنس ليا كان بتاع المكتب مع HCH. وبعد كده لما المكتب ما عملش انشورنس، حاولت ان انا اشوف انشورنس بره، طلع غالي جدا والمكتب ما وافقش، فانا اصلا انا وبنتي انكفرد لحد دلوقتي.
لا ما ينفعش كل ده قانون. فكره على احنا لحقنا ناس كانوا هيرحلوهم مصر
بصراحه ما عارفه اعمل ايه. ما يعني
انا بقول عايزك الحمد لله اللي فات بس لحقنا ناس كانوا هيرحلوهم مصر.
فعلشان كده انا بتاكد يعني هل الورق سليم، هل كان ورقي طلب سليم، كل حاجه.
اهم حاجه غير مسموح ان حد يقف من غير تامين. ممنوع.
ايوه دكتور سمر. ايوه اهم حاجه دلوقتي يبقى معاكي نسخه من السوفت
من الاي دي. صح،
من الاي دي.
طب انا اسال سؤال بعد اذن حضرتك. هو انا لما دلوقتي ادخل على الويب سايت واعمل كرييت نيو اكونت دلوقتي انا ايوه
الويبينار هيخلص دلوقتي.
اوكي.
تليفونات بعض، وفي تليفونات مستر سحوري والايميل بتاعه هو ممثل لينا في المكتب ويدينا كل التفاصيل دي. اوكي. بتتصل بيهم كل الستبس معاكم. مظبوط مستر طويل؟ finish webinar. Everybody who wants to ask for details, Mr. Tawil and his Sahouri company are here to assist till the end. Okay.
Thank you very much.
Thank you.
Okay, Mr. Tawil, you are here.
Also, one last thing. If you ever receive the ID card, just again, simply email ECEB@.com. I have not received my ID
بس كده. صفحة 10 فيها ECEB@sahuri.com. ابعت لهم ايميل وهم يبعتوا لك على طول الكارت على طول، سهلة يعني.
Okay, thank you. Okay. Thank you, Dr. Saul.
هنحط الويب ده المعلومات دي للكل، وتحت معانا تحت امرنا لو احنا عاوزين اي حاجة تاني، اي ويبينار تاني، وان شاء الله. Mr. Tawil, thank you very much. It's very important and very helpful. And it's our duty and yours also to try to propagate the information through email to the others for any other webinar.
Okay. Thank you.
Thank you, Dr. Hazem.
Thank you, everybody.
Thank you, Dr. Hazem. Thank you, Mr. Tawil.
شكرا للكل.
Thank you.
مع السلامة.